Welcome to this short course on bioengineering, where we unpack core principles and real-world applications. This opening slide sets the stage with a DNA motif and outlines three themes: foundational principles, an innovation framework, and future implications. Think of this as a roadmap that will connect basic science to tangible technologies over the next few minutes. This slide lays out a compact covenant for how we'll learn together, emphasizing time discipline, actionable content, audience engagement, and immediate application. Picture those four icons as simple ground rules: crisp pacing, zero fluff takeaways, a prompt to share your single best insight, and a nudge to apply what you learn as soon as the lights come on. Here we define bioengineering as a convergence of engineering principles and biological systems, with the graphic illustrating a flow from molecules to machines. Bioengineering channels design, analysis, and fabrication into health, sustainability, and industrial solutions, so keep in mind, we're blending living processes with engineered tools to solve practical problems across scales. This slide positions bioengineering as a critical response to global challenges like aging populations, climate pressures, and pandemics. The diagram shows how scientific innovation and engineering principles translate into accelerated solutions such as vaccine design, biofuels, and precision medicine, highlighting the field's role in turning urgency into scalable, life-saving interventions. On this page, we follow engineered microbes from gene to product, showing how metabolic rerouting and precise gene edits feed into commercial fermenters. The visual makes it clear that small genetic changes can scale into insulin, biofuels, or bioplastics. So remember that microbes act as tiny factories whose pathways we can redesign for useful outputs. This slide focuses on tissue engineering basics: scaffolding, biocompatibility, and vascularization. The left diagram highlights the essential triad, while the right sequence traces 3D printed hydrogel to implantable grafts. So think of the process as three linked steps: support structure, host compatibility, and blood vessel formation, culminating in functional tissue, ready for implantation. The polymer survey highlights options ranging from natural polymers like collagen to synthetic degradables and smart hydrogels, while the right side lists design rules for implants. As you look at the icons, consider how material choice affects mechanical matching, controlled degradation, and immune stealth 3 design priorities that determine long-term implant success and patient outcomes. This slide introduces genetic circuits, toggle switches, and programmable cells, using standardized biological parts to build logic gates. The visual connects promoters and terminators to CRISPR-based logic for sense and respond therapies. So imagine engineering cells that compute environmental signals and then produce a therapeutic response only when certain conditions are met. The CRISPR protocol slide demystifies the toolkit, with 3 core components: guide RNA design, Cas variants, and off-target validation, paired with a 5-step timeline for rapid gene knockout. The takeaway is practical. Careful RNA design and validation plus an organized workflow can compress editing timelines while keeping safety and specificity front and center. This slide compares bioprinter platforms, inkjet, extrusion, and stereolithography, and outlines a workflow to yield viable tissue within 24 hours. The chart ties resolution and application to post-print maturation steps. So focus on how printing method, slicer optimization, and controlled incubation work together to preserve cell viability and structural fidelity. The organ on a chip page shows lung, liver, and heart models that replicate human physiology using microfluidics and mechanical actuation. These miniaturized systems enable real-time biomarker readouts and high-throughput testing, offering reduced animal use and faster drug discovery, while providing more realistic data about metabolism, toxicity, and tissue function than traditional assays. This slide explains how machine learning and AlphaFold accelerate enzyme development by predicting structure, enabling iterative design loops, and compressing validation timelines from years to months. The graphic shows sequence-to-structure predictions feeding ML-driven optimization and wet lab confirmation, illustrating how computation and lab work now collaborate to speed up validated enzyme discovery. Here we trace the 42-day vaccine path from viral sequence to billions of doses, highlighting steps like lipid nanoparticle delivery, mRNA modifications, and cold chain innovations. The timeline emphasizes that rapid development depends on a chain of engineering breakthroughs, from stable mRNA chemistry to distribution logistics, enabling unprecedented speed in global vaccine deployment. This slide outlines a closed-loop insulin delivery system combining continuous glucose sensing, a control algorithm, and an insulin pump. The diagrams show feedback-driven insulin dosing and clinical impact charts suggesting lowered A1C and fewer hypoglycemic events in pediatric populations, making clear how automation improves stability and quality of life for people with diabetes. The knee repair slide walks through patient-specific cartilage therapy using nasal chondrocytes, scaffold-free bioreactors, arthroscopic implantation, and functional restoration. The sequence underscores a minimally invasive path from cell sourcing to joint recovery, demonstrating how personalized tissue approaches can restore function within months and delay or prevent joint replacement. This slide covers collagen type 3 hydrogel implants for corneal regeneration, pairing a mechanism diagram with 24-month follow-up data. The visuals show host tissue regrowth, improved visual acuity, and nerve reinnervation, noting the potential for application in resource-limited settings where reduced dependence on donor tissue could expand access to sight-restoring treatments. Heritable genome edits raises both promise and caution, mapping arguments for disease prevention and scientific progress against safety risks, equity concerns, and the need for transparent governance. The slide frames the debate. Therapeutic potential exists, but off-target effects, ecological impacts, and fairness demand rigorous oversight and inclusive public deliberation before any clinical implementation. Proactive governance is presented as a three-part system: automated DNA synthesis screening, dual-use review boards, and secure laboratory workflows. The flowchart emphasizes preventing accidental or deliberate release through screening, expert review, and stringent physical and data security, showing that responsible innovation requires both technical safeguards and policy implementation. This slide confronts access gaps by proposing tiered licensing, open-source bioreactors, and global manufacturing partnerships to democratize bioengineered health solutions. The visual contrasts high costs and low-income regions, and the proposal emphasizes practical strategies to decentralize production and adjust pricing so that advanced therapies become feasible in underserved communities. Regulatory pathways and accelerated approval are mapped here, highlighting global frameworks like FDA Fast Track, EMA Adaptive Pathways, and WHO Prequalification, alongside evidence streams such as risk-based classification and real-world data. The message is that coordinated regulatory strategies and iterative evidence collection can enable accelerated but safe access to innovative bioengineered products. Cellular agriculture slide showcases bioreactor-grown meat and dairy, key innovations like serum-free media and scaffold perfusion, and a cost projection curve that suggests price parity within a decade. The intent is to show how engineering advances can remove animals from the production chain while scaling costs down, potentially transforming food systems for sustainability and ethics. Examples of innovation highlight self-healing materials, smart textiles, and autonomous systems, each combining biological function with engineered design. The visuals show microbes repairing structures, fibers responding to pollutants, and genetic circuits enabling autonomous responses, illustrating how living materials and embedded computation are opening new possibilities for adaptive, durable technologies. This slide explores neural interfaces for restoration and enhancement, integrating flexible meshes, gene-edited actuators, and AI decoding algorithms into signal processing systems. The diagram connects core technologies to outcomes like restored movement, speech, and potential cognitive augmentation, emphasizing the blend of biocompatible hardware, bioactive actuators, and data-driven interpretation needed for clinical impact. Space-based bioengineering imagines orbital bioreactors and Martian cyanobacteria, with benefits like ultra-pure pharmaceuticals from microgravity and in-situ resource generation on Mars. The two-panel design invites you to think beyond Earth. Microgravity changes production, physics, and Mars. Adapted organisms could support oxygen, polymers, and closed-loop logistics for long-duration space missions. The fridge magnet timeline offers a practical 4-week roadmap for hands-on learning, from mastering CRISPR basics to pitching a micro-prototype. This slide is a call to action. Short, focused steps, online learning, lab collaboration, in silico design, and a final pitch make biodesign skills accessible and accelerate the move from concept to demonstration. This reprise of the introduction highlights 12 free assets to accelerate your work, from plasmid repositories and visualization tools to literature databases and protocol platforms. Treat this slide as a toolkit checklist. These resources lower barriers, help you visualize sequences, prototype figures, find methods, and connect with community knowledge to speed up practical learning. Challenges and Solutions slide lays out common pitfalls like naming chaos, contamination, and overhype, paired with practical antidotes such as electronic lab notebooks, sterile technique drills, and milestone-based roadmaps. The takeaway is simple. Disciplined practice, reproducible record keeping, and realistic goal setting are the professional habits that transform risk into reliable progress. The blockchain micro-credentials slide describes an earned badge for biodesign skills, completion criteria like project challenges and portfolio submission, and instant social proof via LinkedIn integration. The idea is to combine measurable achievement with shareable recognition, helping learners demonstrate competency while building a visible track record for employers and collaborators. The rapid-fire summary distills 10 unforgettable bioengineering pillars, from cells as factories and tissue scaffolds to CRISPR logic, ethics-first thinking, and global impact. This compact overview is meant to anchor the course. Keep these concepts in mind as core touchstones you can return to when evaluating new technologies or planning your next project. The closing slide invites you to join the bioengineering conversation by posting your key insight with a shared hashtag and promises rewards for top contributions. Consider this an open call to continue the dialogue. Share what sparked your curiosity, connect with others, and use this community momentum to keep innovation practical, ethical, and collaborative.